welcome everyone to Vic Health, the Victorian Health Promotion Foundation in Carlton, and welcome to others who are participating via the video link today. This gathering is a collaborative event with Public Health Association of Australia, Victorian branch, the Aboriginal and Torres Strait Islander Special Interest Group of the Public Health Association, and VACCHO, the Victorian Aboriginal Community Controlled Health Organisation. The recording of the event we're making here today will also be available for viewing via the Public Health Association website. Jennifer Brown of Deakin University will present today on strengthening Aboriginal and Torres Strait Islander health policy, lessons from a case study of food and nutrition. I'm Bronwyn Carter, current Vice President of the Victorian branch of the Public Health Association. I'd like to acknowledge the traditional owners of the land on which we are meeting. I pay my respects to their elders, past and present, and the Aboriginal elders of other communities who may be with us today. I'd also like to welcome Summer Finlay, who is joining us online. She's the Vice President of the Aboriginal and Torres Strait Islander Special Interest Group of the Public Health Association.
Sorry, I'm just going to correct you there. Sorry, I'm a board member of the Public Health Association, and I'm the
Okay, so Summer's talking. Sorry, Summer, we just can't. Your voice is really quiet, so we're just figuring out how to make that louder.
That I'm actually the Aboriginal and Torres Strait Islander Vice President on the board of the association. So I'm a board member of the Public Health Association.
Okay, your voice is coming through the phone that we use, but it's not the audience can't hear you, I don't think. Sorry, we're just getting some IT help to try and get your voice through the...
What Summer said is she's the Aboriginal and Torres Strait Islander Vice President on the board of the Public Health Association.
Okay. Thanks. Sorry, Summer. There's lots of information toing and froing and being collated. And I'd also like to welcome Jennifer Brown, who is with us at Vic Health today, of Deakin University Institute for Health Transformation. Before I go on to introduce people a bit more, I'd just like to recognise and mention the global climate strike taking place nearby here today at the Treasury Gardens at 2 p.m. For anyone who might be interested in attending after this event. So Summer, please correct me if I get this wrong, but I'd just like to introduce Summer a little bit more. Summer May Finlay is a Yorta Yorta woman who grew up in Lake Macquarie. That Summer is currently an academic with the universities of Wollongong and Canberra, but has spent most of her career in the Aboriginal community controlled health sector. Jennifer Brown started her career as a dietitian working at the Victorian Aboriginal Health Service in Fitzroy. And as her passion for population health and prevention developed, she moved over to the Victorian Aboriginal Community Controlled Health Organisation, where she was in the role of public health nutritionist for 12 and a half years. Jennifer completed a PhD in public health at La Trobe University in 2017, and she's currently a postdoctoral research fellow at Deakin University's Institute for Health Transformation. And now I hand over to Jennifer. Thank you.
Thanks everyone, and thank you again for your patience. I'd also like to start by acknowledging that we're meeting on the unceded lands of the Wurundjeri people of the Kulin Nation and pay my respect to their elders past, present and emerging, as well as extending that respect to Aboriginal and Torres Strait Islander colleagues both in the room and listening online. So as Bronwyn said, today I'm presenting some of the findings from my PhD research, which I completed between 2014 and 2017. And the idea for this research came about because I really wanted to better understand how government policy decisions were made in the field of Aboriginal and Torres Strait Islander health. As a nutritionist working for those 12 and a half years in Aboriginal community controlled health organisations, I often found it really difficult and frustrating to attract funding for Aboriginal nutrition, even though it seemed obvious to me and my colleagues at VACCHO that there was such a great need. So that's how I became interested in trying to find out about how policy decisions are made and how we can better influence them. So while my area of interest is food and nutrition, the findings of my research might be interested to other areas of both Aboriginal and Torres Strait Islander health, and perhaps public health nutrition policy more broadly. So I'm sure everyone in this room is familiar with the statistics around Aboriginal health, so I won't go on about them too long, but just quickly to say that chronic diseases are responsible for the majority of the unacceptable gaps in health status between Aboriginal and Torres Strait Islander peoples and non-Indigenous Australians. And that after tobacco smoking, dietary factors and high body mass are the most significant risk factors contributing to the health gaps. It's also important to remember that nutrition issues are a legacy of the ongoing impacts of colonisation, and that food and nutrition has always played an important role in the physical, social, emotional and cultural wellbeing of First Nations peoples. So we know that more action's needed to improve nutrition, but what should policymakers actually be doing? As most PhD students do, I started my research with a systematic review in order to provide an overview of the existing evidence for what works in relation to food and nutrition programs for Aboriginal and Torres Strait Islander Australians. The key findings of the review was that Aboriginal and Torres Strait Islander led programs, especially those that address the underlying causes of nutrition issues, are most likely to be effective. The review demonstrated that evidence was strongest for consistently incorporating nutrition and breastfeeding advice into maternal and child healthcare, and multifaceted community nutrition programs that combine strategies to increase healthy food access, provide healthy food environments, and strengthen nutrition knowledge and skills. But the most important factor determining the success of Aboriginal and Torres Strait Islander food and nutrition programs was community involvement and ideally control of program development and implementation. But is this kind of evidence enough to change policy? What the literature couldn't tell me was how and why nutrition issues come to be priorities for governments in the first place. So that's what I tried to find out. So the things that there were three main questions that I wanted to answer in my research. The first was how and to what extent have food and nutrition featured as a priority in National Aboriginal and Torres Strait Islander health policy over the period 1996 to 2015? Secondly, what were the key factors influencing the prioritisation of food and nutrition in National Aboriginal and Torres Strait Islander health policy during this period? And third, how have different stakeholders been perceived to influence or perhaps failed to influence Aboriginal and Torres Strait Islander health policy? To answer these questions, I used a qualitative case study research design that was informed by various theories of the policy process. I explored policy processes using a range of different methods of data collection, including a review of Aboriginal and Torres Strait Islander health policy documents, an analysis of media articles about Aboriginal and Torres Strait Islander nutrition published in Australian major newspapers, an analysis of stakeholder submissions made during the development of the National Aboriginal and Torres Strait Islander Health Plan, and interviews with 38 different people who'd been involved in Aboriginal health policy development during that period. So my interviews were with a range of different stakeholders, including politicians, political advisors, public servants, Aboriginal and Torres Strait Islander health leaders, Aboriginal health promotion practitioners, public health nutritionists, academics, and a couple of journalists. 15 of these 38 participants were Aboriginal or Torres Strait Islander, and there were Aboriginal people represented in all of these professional groups except for the two journalists. So getting back to my research questions, first, to what extent has food and nutrition featured as a priority in National Aboriginal and Torres Strait Islander health policy? The first part of my PhD involved a review of National Aboriginal and Torres Strait Islander health policy documents. And this slide shows the number of specific nutrition strategies they each contained. It appears that there was an increased prioritisation of nutrition in national policy in this earlier period. And then With the exception of some remote food security work, nutrition had to some degree fallen off the policy agenda in this later period. So taking a closer look at 3 of these documents, in the area of food and nutrition, there's been one specific policy, the National Aboriginal and Torres Strait Islander Nutrition Strategy and Action Plan, otherwise known as NATSNSAP, that was from 2000 to 2010, which was developed following an extensive community consultation process, and it detailed 44 actions for improving food security and nutrition. However, funding for implementation was limited, and since NATSNSAP expired in 2010, there hasn't been a national Aboriginal Torres Strait Islander nutrition strategy. In 2008, ambitious national targets were set for closing the gap, but nutrition was notably absent from the $1.6 billion COAG National Partnership Agreement on closing the gap in Indigenous health outcomes. And in fact, the words food, nutrition, obesity and diet didn't feature in the document one single time. More recently, in the current National Aboriginal and Torres Strait Islander Health Plan, nutrition and food security have been mentioned as policy priorities. However, commitment to resourcing and implementing the recommendations remains unclear. So media coverage is also sometimes a good indicator of what issues reach the policy agenda, as the media shapes political discourse as well as the public's understanding of policy issues. In my search for media stories about Aboriginal and Torres Strait Islander nutrition published in our Australian major newspapers, I only found 79 articles published across the 20-year time period 1996 to 2015. The Australian had the highest coverage with 21 articles, followed by the West Australian with 19, and the majority of articles were from the Murdoch News Limited press. This graph shows the number of articles about Aboriginal nutrition published each year over that period. So you can see that the coverage of this topic has varied considerably over those 20 years. There were 2 peaks in publication. The first in the late 90s, which aligned with the development of NATSNSAP as well as the West Australian food and nutrition policy. And then there was a bit of a hiatus over the next 5-year period, followed by another period of intense media attention here. And in fact, over half of all of the articles were published in that period there. So in this 2006 to 2011 period, the majority of stories were based in the Northern Territory, as this is when the NT intervention happened. So there was a lot of media coverage around that, as well as the closing the gap policy commitments. After 2011, we see a marked reduction in the media coverage overall, with no articles identified in 2012 or 2014. So I think it's safe to say that the contribution of nutrition to Aboriginal and Torres Strait Islander health inequalities has been inconsistently represented in Australian newspapers, just as it's been inconsistently represented in national policy. So how do these policy debates play out in the media? The newspaper articles could be categorised as serving one of 6 policy functions. The most common was highlighting nutrition problems. So an example of this was the headline, "Remote Hunger Rife Finds ABS." And this finding of problematisation in Aboriginal health is similar to previous research that has found that media reporting of Aboriginal health issues is predominantly negative. But there were also stories about solutions and about promoting success stories, and these often had more positive headlines, such as "Doctors think inside box for fresh approach to health." Governments also use the media to promote their policy announcements, such as "Push on to boost Outback nutrition." And there were also articles which critiqued the government's approach, such as "Outback stores is not the solution." And then there were articles in which the government defended its policy approach, such as "Remote food sales up, Macklin insists." The majority of our articles did focus on nutrition issues in remote communities, and the government rather than community voices were most commonly represented. My interview participants also described how prioritisation of food and nutrition has changed over time. In this quote, a former political advisor reflected that while government interest in nutrition had varied, the level of interest in the community remained high. She said, "I think it probably has changed at different times, more probably from the government and the government interest versus the interest on the ground, because I think that there's probably been a high level of interest on the ground in terms of recognising the importance." There was general consensus among interview participants that the high point for Aboriginal and Torres Strait Islander nutrition policy was in the late 1990s through to the mid-2000s, a period that this participant described as the golden era. She said, "I just think that was really a strong focus, and there were a lot more community health kind of promotion, and it was really locally based, and there were some big national frameworks that were having a policy impact at that time," referring to NATS&SAP. Participants noted that nutrition had faded from the policy agenda in more recent years, both as a public health issue in general and specifically in Aboriginal and Torres Strait Islander health. So as this public servant said, "I think it's probably got less. You know, there was a while when we were trying to do something with nothing, which was NATS&SAP, referring to the attempts to implement the national strategy with limited resources. Another health bureaucrat described nutrition and physical activity as the poor cousins to other health issues such as immunisation and tobacco, which were viewed as higher political priorities." So the rest of my PhD sought to understand the key factors influencing this varied priority of food and nutrition in national policy. And to answer this, I'll focus on the findings of my interview data. So using a framework I adapted from Schiffman and Smith to analyse the interview data, I identified 4 categories of factors influencing the prioritisation of nutrition. The first one, actor power, is about the strength of the individuals and organisations concerned with food and nutrition. Ideas is about the ways in which policy advocates understand and portray an issue, in other words, how they frame it. Political contexts covers the political environments in which we all operate, including governance structures and opportunities for promoting policy proposals called policy windows. And finally, there were characteristics about nutrition as an issue in itself that may have constrained its position on the policy agenda. And these included the fact that nutrition is a complex issue spanning a range of program areas. The multifaceted nature of nutrition makes it difficult to measure, unlike smoking, which is just one thing. And there's a feeling that self-reported dietary data can be quite unreliable. There are many, many pressing issues, as we all know, in Aboriginal and Torres Strait Islander health, often competing for policy attention, and the limited resources for health promotion and prevention means that nutrition often has to compete with other issues like tobacco, physical activity, and we know that all of them are important. Compared to some other issues like tobacco or alcohol, nutrition can be less visible, so might appear less urgent as well. And finally, the limited evidence base for food and nutrition policy, especially simple, politically palatable solutions, was seen as another barrier. Some of these challenges are summed up in this quote from a public servant. "So you've got a problem, which is a bit tough because it's different issues, it's not in your face, it doesn't have a single group advocating for it, and it doesn't have a single neat solution." Interview participants identified several political and institutional challenges to advancing nutrition policy. These included tensions between Commonwealth and state governments, changes to institutional and governance structures, especially the dismantling of the National Public Health Partnership and its Nutrition Committee signal, which really drove the NATS&SAP strategy, and the neoliberal preference for an individual responsibility approach to food and nutrition policy. In addition, many nutrition and health promotion practitioners reported that they felt ill-equipped to be policy advocates, and as a result, opportunities for policy change were missed. Two of the themes arising from my interview data related specifically, actually, sorry, first I'll read this quote. So this is a quote from one of the two politicians that I interviewed about why he thought nutrition had fallen off the agenda in the Closing the Gap. He said, when you do a national strategy, it has to have endorsement from all the jurisdictions. It cannot be a majority of the jurisdictions. It has to be every one of them. And at some point, it was argued that nutrition was not the priority for one or two jurisdictions, and that's why it fell off. So moving on to the final research question, which is about how different stakeholders have influenced the policy agenda. The theme of actor power is about the fact that most of the interview participants thought that effective advocacy was about stakeholders coming together and speaking with a collective voice. However, several participants reported that the nutrition policy community had become fragmented since the National Public Health Partnership had been disbanded, as well as several state and territory governments reducing the capacity of its nutrition workforce. Effective leadership was also cited as essential for advancing food and nutrition policy, as well as the need for champions, both inside government and external to government. Much of nutrition policy has been driven by non-Indigenous nutritionists, people like me, and participants noted that more Aboriginal and Torres Strait Islander leadership was needed for food and nutrition policy. In addition, nutritionists as a professional group may be less prestigious than doctors, for example, and some wondered whether the fact that the workforce is primarily female may have also had an impact, as most of the decision makers in politics are male. So this quote from an Aboriginal health leader emphasised the importance of building a strong collective Aboriginal-led voice in policy advocacy, which has happened in other policy areas. There were all these things happening in food and nutrition, but it hasn't come together. Where in smoking, it had already come together. Mental health, it definitely came together. A key finding of my research was that while evidence is important, it's usually not enough to change policy. Advocates need to frame and communicate their policy ideas in a way that will resonate with political leaders and the general public. Food nutrition is a complex issue which can be framed in multiple ways, such as in terms of food security, food and nutrition, obesity, or early childhood development. Interview participants reported that there appeared to be a lack of consensus within the nutrition community about the priority nutrition issues and the appropriate policy responses. Constructing a compelling narrative and a pitch to government about what the facts are, what the benefits are, and what we're actually seeking was seen as essential to positioning food and nutrition as a policy priority. And that's really summed up by this quote. Nutrition policy has some very compelling advocates and very compelling public health, but it struggles at times because there's not a very compelling narrative. If you do X, Y, and Z with this amount of resource, this is the health benefit. So I'll just jump now to the final document analysis study I did as part of my PhD, which involved combining network and framing analysis to examine the submissions made by organisations to the National Aboriginal and Torres Strait Islander Health Plan. I looked at the way organisations cross-referenced one another in their submissions to generate a network map depicting the ties between the different organisations. So in this rather messy diagram, the coloured dots represent the organisation type. So the red and the maroon circles represent Aboriginal-led organisations and coalitions. The light green dots are the kind of health professional organisations. So you can see the Public Health Association kind of in the bottom right corner. And the size of the dots represents the number of times other organisations reference them in their submissions. So you can see that the big Aboriginal organisations and coalitions were really central to the network, such as NACCHO and the Close the Gap Coalition.
Someone's just unmuted and there's a bit of background noise. Can we just mute that again? Thank you.
Thank you. And so these central actors, the really large circles, had ties with not only within the Aboriginal community controlled sector, but also with many mainstream organisations, in particular the medical profession, which are the dark green circles in the bottom left of the screen. So this big network can also be subdivided into different subgroups or cliques, which each have their own area of interest. And what I found when I did my framing analysis, and this image is an overlay of the frames used over the network, I found that the most highly networked organisations were also closely aligned in terms of the policy discourse they used in their submission. For example, the Aboriginal community controlled subgroup in red tended to use a self-determination frame in their submissions. The medical subgroup, which is the purple square, used biomedical framing. The kind of health professional allied health group used primary healthcare framing. And perhaps most interestingly, in the top, in the orange, there was an eye health subgroup. And this was by far the most densely connected subnetwork of organisations, and they were all very united in the ideas and proposals they put forward in their submissions. So what about nutrition? The stars on the map indicate the organisations who were advocating for food and nutrition in their policy submissions. And unlike the eye health advocates, which were highly networked, highly united in their framing, nutrition advocates were less well connected both with one another and within their own subgroups, and kind of were offering a scattergun of recommendations rather than a united front in what they were pushing forward to policy. So I guess this kind of illustrates what my interview participants were saying about nutrition advocates needing to come together and speak with a collective voice. So, bringing it all together, if we think nutrition is an important issue in Aboriginal and Torres Strait Islander health, and we'd like to see it back on the agenda, here are some things based on my research which might help. I combined all the key findings from the different studies to produce a new framework for advocacy. And although this framework is derived from my study of food and nutrition policy, it may well be relevant to other areas of Aboriginal and Torres Strait Islander health policy where stronger policy action is required. The framework consists of 6 interconnected elements. The first is evidence. So of course, evidence is needed to support health policy decisions, and this includes evidence about indicators to measure and monitor the health issue, as well as evidence-based policy solutions. But we know that evidence isn't enough. So the next one down, stories, is about how advocates need to decide how to best frame and communicate technical information about a health issue or tell its story. And this is important so that it will resonate with decision makers and the general public in order to win people's hearts and minds. These stories need to be strategically communicated by coalitions of individuals and organisations who share common policy goals. And critically, while improving Aboriginal and Torres Strait Islander health should be everybody's business, this advocacy should be led by Aboriginal and Torres Strait Islander people. So that's why Aboriginal and Torres Strait Islander leadership is up the top of the framework. A coordinating home base, the circle down the bottom, means having an organisation or coordination mechanism that has the capacity to guide policy and advocacy activities. And finally, once an Aboriginal and Torres Strait Islander-led coalition has been established, armed with evidence and a unified story about the policy issue, it's important to be ready for windows of opportunity for strategic advocacy. So this framework's just an initial proposal based on my research, and now it requires implementation and testing and, if necessary, modification. if you'd like to access the framework, it's just been published in the most recent edition of Public Health Nutrition, and it's also publicly available in a community report which VATCHO produced and is on VATCHO's website, and there's the link. So that was my PhD research. I'll just briefly mention the projects that I'm now working on now that I've started my new position at Deakin. I'm very fortunate and grateful to have received a grant from Vic Health very recently to continue working in partnership with my colleagues at VATCHO and to try and put some of what I learned in my PhD into action in a new project called Food and Nutrition Policy for Aboriginal Victorians, Evidence and Advocates for Change. And in this project, we'll be identifying which population food and nutrition policies are likely to be most effective and acceptable for Victorian Aboriginal people and supporting Aboriginal-led advocacy campaigns for policy change. So the Uluru Statement from the Heart, which you can see up on your screen, asserts that the rights of First Nations peoples to have a voice on all matters that impact them. And food and nutrition policy is one of these matters. So I hope that this research can help support a voice, and I encourage everyone to jump online, the URL's there, to pledge your support for the Uluru Statement if you haven't already. And last but not least, I really want to thank and acknowledge my PhD supervisors, Dr. Deb Gleeson, Dr. Rick Hayes and Professor Karen Adams. Equally important were my advisory group members, which included Summer, as well as Dr. Mark Locke, Deanne Minicon, Lynn Dimer, Sharon Thorpe, Nicole Turner, Dr. Vanessa Lee, Peter Atkinson and Lang Bolch, as well as my funding bodies, VATCHO for producing the community report and Shakara Montalto for doing the beautiful artwork that's in it. I'll just do one more shameless plug of my publications, and thank you all very much for listening and for your patience. I think we're going to take some questions from the online listeners first, and
Yep.
Summer's going to moderate that. I think for the technology's sake, maybe if Summer, you say them and then I'll repeat them for the audience so we don't have to muck around with muting and unmuting.
Sounds like a plan. So does anyone have on, thank you very much for that, Jen. I have to say it's been a while since I've heard about your PhD and it reminds me how important the work is, so thank you. Does anyone online have any questions for Jen and want to type them in so I can read them out? Or while you're typing, maybe Jen, maybe take one from the group that you're in while they
Does anyone
type.
have any questions? I've stunned people into silence.
Jen, it's Summer here. While people are thinking about their questions, I wonder if you could talk a little bit more about what you found in the media and whether or not you think that it would be useful for people in the nutrition space to be utilising media.
Yeah, did everyone hear that question? Okay. So, yeah, I just presented a small proportion of what my findings were from the media analysis. But part of what I looked at was which voices were represented. So I mentioned government was most represented, and one issue I found was that there weren't enough Aboriginal voices, more so in the more recent articles, which was a good development. But in terms of nutrition advocates, there were, I mean, the joint policy statement that PHAA, DAA, Red Cross and VATCHO put out about Aboriginal food security did get a bit of coverage. So I think that was a really, doing that policy statement and putting it out in the media was worthwhile because it did get picked up. So I think doing things like that can be really helpful. Other than that, the main other kind of nutrition advocates that were featured in those stories were researchers. So I guess researchers who published a study and did a media release. But in terms of just grassroots people working on food and nutrition in NGOs, there wasn't that much. So that might be just something else for people to consider doing in terms of their advocacy. Yeah.
And if I could do a shameless plug for Croaky. Croaky is always looking for opinion pieces from people that are working in the space. So if you don't know Croaky, check them out, but we would love some more articles from people on the ground.
Everyone heard that?
I think the people online are a bit shy, so maybe anyone else in the room want to ask you anything, Jen?
Any questions? Oh, yep, there's a question, and I'll repeat it for the online people.
I was just wondering about the political perspective of this, and I was wondering like how it could sometime bias a case study depending upon the different politicians and how huge that impact could be on something like this.
So the question was about the political aspects or the political influences and the different impact of different political parties, was it?
Yeah.
So a lot of the interview participants commented about the growing kind of neoliberalism in our political context, and especially that the current government was kind of very much saw nutrition as individual responsibility. It's not up to government to tell people what to eat. I think our former Prime Minister, Tony Abbott, was quoted as saying, no matter who you are and where you live, everyone can eat better and exercise more. So that came out a lot, that government was very unwilling to act in the area of nutrition. But interestingly, the NATSNSAP strategy was developed under the Howard government. So I think it hasn't just been a Liberal versus Labor thing, but as time goes on, the context has become more individualistic.
Fantastic. Jennifer, I've just got a question here from Colin Bell online, and then I've got one by Troy Walker as well, so I've got two. Colin's just asking, is nutrition a Western construct? He's interested in what Aboriginal and Torres Strait Islander communities think about the angle policy comes from, which may be too narrowly focused on health outcomes.
I'll answer that question in the capacity that I think is appropriate for me to answer that, and maybe Summer, you can expand on it. But I know that my Aboriginal PhD supervisor, Professor Karen Adams, every single thing I wrote, she was always emphasising that I had to emphasise it's not just about nutrition. Aboriginal health is seen as a holistic view, and nutrition's just one aspect of that holistic view of health, and that potentially, if it's driven by non-Aboriginal dietitians who don't have that view of health, that is a problem. And I often reflect on this as a nutritionist when I go to conferences, and then there's the nutrition session and we're all off in our nutrition room listening to nutrition talks and basically talking to each other, compared to the rest of public health kind of integrating with each other a bit more. I think that is a problem for nutrition if we're too much of a bubble and not intertwined with the rest of health, and we shouldn't be competing against each other. But in terms of what Aboriginal people think about food and nutrition, I guess I'll throw to my Aboriginal colleagues to answer that question. And I guess that's something, in terms of what Aboriginal people think about nutrition policy, that's something we hope to find out in our new research that I'll be doing with Michaela from VATCHO, who's in the room here.
Oh, hey, Michaela. Michaela might want to answer, but if I could throw my 2 cents in, I'm not sure that Aboriginal and Torres Strait Islander people think about policy per se, unless you work in the space like we do, if you're in public health or in that advocacy space. I think most people are thinking about it being either people like me who are comfortable and I just like good food, but for those that actually are probably the people that are needing most to know about this stuff, they probably know about it the least. And I do think it is by the way, Colin, I do think nutrition is a Western construct, because we talk about having, healthy families and healthy communities. So, and nutrition is just part of that, as Jennifer was saying. So I think if we frame it, and this is just a gut feeling, and someone else might have a different viewpoint, but if we frame it that what we put in our bodies helps us be healthy and happy, and if we're actually feeding our families, we're helping them be healthy and happy when we're feeding them well. Anyone else want to add anything, Michaela? Or
Yeah, I don't know if they're going to be able to hear me.
I'll repeat. Oh, I can.
Oh, do you want or do I just hold it like? Yeah. So yeah, okay. I agree with what Summer was saying, and it is more people like us who are interested in policy. But the government, the way we're funded is in silos, and we're all funded for each different area. So at VATCHO, there's eye health, e-health, nutrition, smoking, all of that. So we're often trying to suit the needs and the KPIs and the targets, I hate that word, of what the government is giving us. And it's taken a very long time for us to say this is what our community priorities are, and they still don't fund it. As Jen has shown you, we know it's important and evidence is not enough. So what is going to be enough? And we've seen in tobacco, when they took a healthy lifestyle approach, it was taken off the national agenda. So the Tackling Indigenous Smoking teams were funded for smoking, cessation and healthy lifestyles. So they were doing everything, whereas then, and an evaluation showed that was working and that was great. And they went, oh, it's working. Okay, cut that part of it and just do smoking cessation. So we're at this like point of we would love to integrate at VATCHO just to be healthy lifestyles and look at everything from a holistic point of view, because like Colin asked, it's that Western construct and we're trying to decolonize the way we look at things. And I think we can do that on our own, but we're so reliant on funding and government funding, and it's about how do we flip from our perspective, because I don't think community cares where the money, that's why we're all in these positions, is how do we sustainably do that? And then you've got all the issues of food environments and access and affordability, and depending where you are in Australia. So I don't know if that answers your question, but it's the ultimate struggle that we have is funding, I suppose. And if we could get away from government funding, that would be amazing. And if we didn't rely on their policy agenda, it would be amazing. That's my answer.
yeah. I've got Colin's just said thank you for that. Now we've got a question from Troy here. He's got a couple of questions in here, so I might break them up.
Some we've got one more comment on that last question.
Oh, my apologies, sorry.
Oh, okay, no, it's another question. Sorry, we'll have Troy's question.
So Troy's just wanting to ask you, and this is a question that I would probably ask too, so thank you, Troy. What actions, using all media formats, including social media, do you see as most effective for reaching Indigenous populations on a state and national level?
Well, again, I don't feel qualified to particularly answer that question. What media formats, including all the different forms of social media, are best for reaching Indigenous people nationally? One thing I will add though is, so I only looked at mainstream newspapers in my study. So, you know, the Australian, the Herald Sun, the Age, Sydney Morning Herald, all those big mainstream newspapers. But I just supervised a master's student who's just completed her thesis, and she looked specifically at the Koori Mail. So for those who don't know, the Aboriginal Torres Strait Islander specific national newspaper. And she only looked at a 5-year period, the last 5 years of the Koori Mail, which is a fortnightly newspaper, unlike the others, which are mainly dailies. I looked at 20 years of all our national dailies and found 79 articles. She looked at a 5-year period of a fortnightly one newspaper and had 102 articles.
Wow.
So I guess the finding from that is it's not that it's not an issue in the community and community aren't interested in it. So yeah, it was a very stark difference, the mainstream newspaper compared to the Koori Mail. And the other difference was the framing of the stories, whereas especially the earlier articles from the mainstream papers in the 1990s, some of those headlines blatantly read racist. And in the Koori Mail, there were so many more success stories, so many more Aboriginal voices in the stories. Sometimes it's hard to believe you're talking about the same country.
Mm.
But in terms of other forms of media, I didn't look at social media at all. I think anecdotally, at least our experience at VACCHO was we found that social media was pretty successful, but I don't know if anyone else has any comments.
Yeah, it's Summer here. I have done...
Summer's prolific on social media.
But there's actually a lot of research that shows that social media is actually a very good tool for Indigenous people connecting with other Indigenous people, both in Australia and globally. And there is also some research to show that health promotion is effective on social media. Having said that, though, there is also evidence to show that using mainstream media is very effective to change policy, which includes one of the most notable ones, which is not so great, is that the intervention was actually driven largely by media. So when you do actually use media and use it consistently and have common messages, it can actually drive change, both positive and negative.
And I think Troy is probably more the expert on social media. He just did a systematic review on the topic.
And he's actually...
Thanks, Troy.
He's also asked you another question. He says, you've outlined negative or deficit-based coverage being common and likely ineffective. What do you think might actually work in the future?
That's a really good point. So I think the results of this study have some important lessons for, especially for non-Aboriginal journalists, but also health professionals, advocates who are trying to use the media. It's important for us to be really careful about how we speak to the media, what we put in our media releases, so that either what we say doesn't come across as deficits based, or that we can't be misquoted, and what we say in our program and our media release being used to perpetuate that deficits discourse. Fantastic. So I think that was the key takeaway I took from that study, that the media is important for advocacy, but we need to be very careful with it.
Yeah. I don't have any other questions online, but you had a question in the room,
yes,
Jen?
Nari has a question.
Hi, this is Nari Blow, Yorta Yorta, Noonuccal Goring woman. Currently, I'm a public health registrar and doctor, and newly appointed onto the board of the Australian Indigenous Doctors Association. So I guess my question, it's kind of two parts, is what do you think, I guess, the role, because this is something that we're only just introduced to medical students this year, is actually teaching nutrition, which had not really been a priority for medical students. So what do you think the role of bodies like the Indigenous Doctors Association is? And also, do you think it's more important to have a bigger role from Aboriginal organisations, or do we need it more from mainstream organisations, considering you've pointed out that a lot of Aboriginal organisations have really been already driving a lot of this?
I think the Australian Indigenous Doctors Association is key. I interviewed some past and present members from that association as part of this research. I think they're key because, as you saw from the slide, Aboriginal organisations were central, but another key finding was that doctors were viewed as... Government is more likely to listen to doctors than nutritionists, and probably so are the general public. So I think having that dual, they're an Aboriginal controlled organisation and they're doctors, I think they're potentially very powerful advocates. And in terms of that, speaking with one voice, if the Doctors Association is saying the same thing as PHAA, as all the key organisations, if we're all speaking with one voice, public health, nutrition, community control, doctors, including both AIDA and the AMA, I think they're all equally important players.
And do you think we also need it from the AMA, more mainstream?
So the question was, do we need it from also the AMA, the mainstream doctors? And yes, yeah. Yeah.
Yep.
So yeah, a lot of participants thought that the AMA was a very powerful organisation in terms of who policymakers listen to.
Jen, I'm just conscious of time, so if everyone's got a few extra minutes because we did start late, that would be great. But if anyone has any questions, now is the time to ask them of Jennifer.
So Christina's got a question. I'll just hand the phone to her.
Thanks, Jen. That was great. I was just wondering, with the government planning to announce the obesity prevention strategy soon, how much coverage do you think Aboriginal health will get in that? And is it a good opportunity to potentially advocate for Aboriginal health?
So I actually was able to speak to one of the people involved in developing that strategy just recently. So they've been given very, very tight timelines from the federal government. But what I was told is that towards the end of this year, there's going to be a consultation draft of the strategy that will be publicly available, and they'll be taking submissions and feedback on the draft. And the plan is to do a specific consultation process for Aboriginal and Torres Strait Islander Australians. So I guess in answer to your question, yes, Aboriginal and Torres Strait Islander people are being prioritised in this strategy, and feedback will be sought. In terms of how big that opportunity and how much time all stakeholders will have to feedback, I imagine it's going to be tight. So, but it's definitely an opportunity, and we need to keep our eyes out for when that opportunity is.
Has anyone got any other questions online for Jen? I'll just say that Troy has said that thanks Jen, Summer, Michaela. Social media really gave me a mixed bag of results based on age of users, where mob are from, and so I was interested to hear all your thoughts. Has anyone else got any other comments or questions for Jen? Jen, I would actually just, one of the things that really stuck out for me is that there's multiple narratives going on. So policymakers obviously have competing priorities, and they also are probably not across the issues as much as, say, nutritionists or other health professionals. How do you suggest that, I mean, I know you've talked about having a coalition, but in the meantime, because that may take some time to get off the ground, what do you suggest people do in the space to actually make sure there's consistent messaging?
I think because we know these policy opportunities are coming up with the National Obesity Strategy, I think that nutrition advocates and nutrition organisations and people interested in the topic need to be planning for that now. We need to be deciding we need to be having our arguments and our disagreements behind closed doors, for one, and then deciding what we all mutually agree on, so that when that very tight opportunity for consultation does come, we can all be on message. We can all be making the same recommendations, which we've agreed between us are priorities. Because that's what I found looking at other submissions. For example, the iHealth Coalition, they were so disciplined in their asks. So I think that's what we need to be doing. Nutrition's big, and it's endless what we could be prioritising, but we need to be strategic and agree amongst ourselves what our key message is. And because politicians are dealing with lots of things, they have short attention spans, we need to make it easy for them and say, like that quote that I showed, we want you to do X, Y, and Z.
I would agree with you. As someone who's been involved in writing numerous submissions and working at the policy level, it is very frustrating when there is competing priorities and there's conflicts between what should be allies. So, and yes, fighting behind closed doors is always better in public, in my opinion. Do you have any final thoughts to share, Jen?
We have one more question.
Oh, perfect.
And you're probably not going to be able to answer, but given that you all agree that a coalition is needed, who do you recommend to be the first one to take that first step and get the ball rolling?
I think that's a really interesting point, because one of the key findings was that when the National Public Health Partnership was lost, that what I called coordinating home base was lost. So which organisation, I mean, we can all be organisations or individuals who are interested, but we need someone to drive it. So the example with the Close the Gap Coalition, they had the Human Rights Commission is kind of the home base that's driving that campaign. So I don't know what the answer is for who the appropriate home base is, whether it's PHAA, perhaps. Yeah, that we need it. I don't know who it is, but I think that's definitely a key piece of the puzzle. I guess if it's going to be national, it has to be a nationally focused organisation. It has to be an organisation that is credible, that, hasn't kind of been involved in any scandals, that is respected, that's going to that all the other organisations are going to agree with. A unifying organisation.
Yeah.
So taking applications.
Well, it's certainly, as a board member of the Public Health Association, something that we can talk about internally. But I do wonder as well whether or not we'd need an Aboriginal partner in this in the establishment, given that Aboriginal food and nutrition is such a significant issue.
Yeah, and perhaps whether it is the Indigenous Doctors Association, Indigenous Allied Health Australia, there are Aboriginal-led organisations where nutrition is potentially a big part of their interest.
Sure.
But of course, I can't decide what their priorities are going to be.
Certainly something to chat about, and maybe we need to continue these conversations, Jen.
For sure. I guess you asked if I had any final words. I guess I'll make a very clunky segue that I think one of the other key challenges facing Aboriginal and Torres Strait Islander nutrition, and indeed all our health and nutrition, is climate change. But those living in rural and remote areas are probably going to be disproportionately affected, especially those living in island communities. So hopefully everyone will now be proceeding to their their climate strike. So we'll form an orderly line and march down to the Treasury Gardens from here.
And your absence will be noted, no doubt. Yeah. Thanks, Jen. It's just, if I could just reflect for a minute on the things that have really stuck out for me, is that there needs to be a coordinated approach, and that we need to make sure that that coordination is done with Aboriginal leadership and is Aboriginal-led. Aboriginal and Torres Strait Islander led, sorry. And for me, I think that it is really key that maybe narratives actually start to form. And I have to say, in my experience, most researchers and health professionals are not very good at communicating to the general public. And so maybe we need to think about partnering up with health communicators to make sure that we can really drive home a good message.
Definitely. Okay, I'm going to hand back to Bronwyn.
Thank you, Jennifer and Summer. Just a few quick closing remarks. I'd like to join with everyone who's here and who's listening online to thank Jennifer for her presentation today. It's a fantastic opportunity that you've provided for us to hear about your work. Very informative, and thank you very much. Also like to thank Summer Finlay, and also like to thank Olympia Saris on the Vic Branch Committee, who did a lot of the organising of this event today and liaising with Jennifer and Summer. Vic Branch of the Public Health Association has been very pleased to be able to host this event today. Thank you everyone for your participation and your interest. Just to let you know again, the recording will be available on the Public Health Association website sometime soon for other people who weren't able to join us today. Thank you everybody, and good afternoon.
Have a good evening. Thanks, guys.
Okay.